Welcome, everybody. This is Dr. Drew Leader from Loyola University, Maryland, and I'm going to be talking from a new book of mine called The Healing Body: Creative Responses to Illness, Aging, and Affliction. And in it, I go through what I call a chessboard of healing, 20 different strategies that people utilize when they're trying to reintegrate a life that has been torn apart by illness or disability or simply the chronic changes of aging. And today I want to talk about the strategy I call remembering. And first, it may be helpful to say that our body is always something that is in time and is changing over time. We feel differently in the morning than we do in the afternoon. We certainly feel differently at age 20 than we do at age 60. So change is simply a part of our embodied existence. However, sometimes those changes are challenging. You could meet with a sudden accident. You could tear your ACL. And suddenly have many, many, many months of rehabilitation to face. Or you can just discover that you have developed a chronic illness you have to deal with, or that as you get older, your body simply can't do what it once did. And so our customary relationship to time is changed. Instead of simply having a set of habits, abilities, and experiences from the past that set us up nicely for future projects and goals that we are working on and working toward in the present. Suddenly, this illness, injury, disability can fracture time. So we're no longer connected to our past. We're in a different position. We have to question our future. We may not be able to do the things we once thought we could. And our present is enveloped in an experience of pain and limitation. So we have to construct a new relationship with time. We have to, in a certain sense, heal time, chronic healing, the healing of chronos, the Greek word for time, goes along with chronic illness. And one of the strategies that people utilize, as I mentioned, is remembering. That's the space on the chessboard we're dealing with today. Remembering is simply to say that people who find themselves in a new and more constricted embodied position due to illness and injury often find some real meaning and consolation from remembering the things they were able to do, the things they accomplished in their lifetime. I was talking with a friend of mine who has Parkinson's, and she, her mobility is now limited, but she remembers really fondly when she climbed Mount Washington. And that's a very kind of precious experience for her. She can recall it and she can feel a sense of satisfaction about her life, having done the things she was meant to do, even if she's no longer able of doing them. And as we get older, Robert Butler, a gerontologist, invoked a really powerful idea of the life review, that this is a natural part of aging. Sometimes we will find regrets and disappointments, but in other cases, we will find things in our life that were really kind of valuable and meaningful. And it gives us a greater ability to accept that we're now older. But we've lived fully and well. Now, of course, any healing strategy that I discuss has a shadow side when used excessively or inappropriately. And I think we can see this with remembering that it can be kind of painful, this focus on the past, because it does keep reminding oneself, I used to be able to do this, and now I no longer can. And there's a kind of nostalgia, which is from the Greek word nostos, meaning home, and algia, meaning pain. So nostalgia is in many ways the pain of being away from home, in this case, kind of our previous home in time. It's painful to not be able to do that anymore, to not recover that, to feel cut off from who we once were. So the big question with remembering is, does it bring us kind of meaning and consolation when we're facing bodily limitation? Or does it bring us the opposite, a feeling of regret and desolation? Especially with the latter, it can also distract us from all the things we still can do in the present. We're so focused on the I can't do what I once was able to, that we don't fully explore and appreciate. Maybe I can't climb Mount Washington, but I can still go for a nice walk on the path near my house. Maybe I can't go on a trip to Europe, but I can still enjoy going out to coffee and lunch with my friends. So there's some real value in remaining focused on the present and not simply the past. And shortly, I'll be talking about the healing strategy I call presencing. So thanks very much for watching today. Hope to see you soon.